My name is Nicholaus Mazuguni. I'm a specialist in obstetrics and gynecology, and I come from Tanzania. I work in a consultant hospital called Kilimanjaro Christian Medical Center that is located in northern Tanzania. So talking of infertility challenges in our country, we have 3, if not 4 major problems if you're talking of infertility. The first one being the human resources. This is a very big challenge because to have a fully functioning fertility center, you need a trained personnel in terms of embryology, in terms of clinicians who will be stimulating patients before they undergo assisted reproductive technology. So human resources is a very huge challenge. We have very few, if none at all, personnel who are trained specifically for infertility care. That's number one. Number 2 is the infrastructure. You can't attend patients if you don't have a center that is dedicated to do that, and neither of the government institutions have any of this facility. We have very few centers, private centers. I can say less than 5, and so infrastructure is one of the big challenges. But the third one as a major challenge is a challenge that is being faced by the victims of infertility. And here I'm talking about the couples that have suffered from infertility. Infertility being as a problem that will affect both male and female, but in our country, traditionally people think that infertility affects only women, and women have been blamed that are the reason of infertility. We have seen so much of the intimate partner violence, we have seen so much of the domestic violence, we have seen so much of gender-based violence just because of the belief that people are having towards infertility. So the fourth challenge is the cost for infertility care. The few centers that we have, the cost of infertility care is very high, and it's very high. It's understandably it's high because you have so much challenges in terms of having these drugs that we use to stimulate patients to get it in our country. To have these medications is a very huge challenge. You have to order them from outside our country, and the cost of freight, the amount that you pay in terms of making sure that it is being registered is so huge. So the cost is very high, and majority of our patients have been opting to go outside the country, which also again is a very huge challenge in terms of cost-wise. And the last challenge that I can say that is very important to be addressed is the issue of lack of already set policies and guidelines to guide the infertility practice in our country. To date, I can say we don't have any set aside laws that will govern or lead people to offer infertility care. The other major challenge is the lack of awareness for infertility services. You work in a center and you see infertile couples coming in. If you ask them if they are aware of any other treatment options, most of them, they have never even heard about assisted reproductive technology. Things like intrauterine insemination, IVF, IRSI. These are not well known, or our patients are not informed about these issues. Okay, I'll say the way the training has been structured is excellent, with the fact that it has taken on board the 2 components of infertility. That number 1 is understanding the anatomy and physiology of both male and female when it comes to infertility. You cannot explain the abnormal if you don't know the normal. So the training has been structured in such a way you are being trained to understand the physiology, the anatomy of both male and female reproductive system. But the second part of our training is the theoretical part in terms of assisted reproductive technology techniques, and this was well covered. And the third part, I would say, has been the practical aspect of training, which have emphasized more on how to prepare sperms. That's number 1, because you need sperms in order to get good embryos. Number two, we have been trained very well how to do follicular fluid screening to get the oocytes that later you inject with the sperms. And the third part, once you have injected the sperm in the oocyte, then you need to know if your fertilization occurred. So this was also well covered in terms of the laboratory exposure. So the opportunity that we have had to understand the basic principles and advanced methods of making sure that you have a very good outcome in terms of assisted reproductive technology has been well covered. I would like to take this opportunity to express my sincere appreciation to Merck team through the Merck African Embryology Training Program of More Than a Mother project. This is a very huge responsibility that Merck have decided to take, and it should be an example whereby every other stakeholder should learn from Merck. Building a capacity in Africa is one of the very important issues that should be taken on board if we really want to deal with infertility. And I believe in the next 5-10 years to come, this will be a job well done.